Good morning. The video you have just watched underlines why we are all here today. The impact of poor mental health is devastating to individuals, to families, and to all of us as a veteran community. But the uplifting conclusion reminds us we can all make a difference. It also reminds me of the urgency we have in meeting the challenge of tackling poor mental health. Veterans' mental health needs are not often that much different to the needs of the general population, but it is true that for a long time the UK government didn't take the mental health of the veterans community seriously enough. For me, of course, it's personal. Trying to reset the UK government's relationship with her veterans was why I entered politics. I fought those wars with you, and I promised I would do all I could to change the provision of mental health services to our veterans. At this conference last year, I told you that I wanted to accelerate the high-intensity service, to bring it online as the third part of a clear, easily understood and widely accessible world-class mental health care pathway for our veterans. I'm here today to tell you that we've done just that because of the wonderful staff of the NHS under the leadership of Sir Simon Stevens. And yes, it does require real strategic leadership and a commitment to our veterans beyond warm words, driven by characters like Kate Davies and others who have worked so hard in this sector for so long. Today, I can announce the launch of Op Courage, the Veterans' Mental Health and Wellbeing Service. I promised you we'd look at veterans care in the UK differently to how we had done in the past, not marking our progress by how much we were putting into the machine in Whitehall, but how it actually felt to be a veteran in the UK in 2021. There has been some clear progress in recent years. The NHS is now treating over 20,000 veterans a year. With the new high-intensity services online, we'll be spending £16 million per year on Op Courage alone, increasing as more services come on stream to £20 million a year baked into the long-term plan for the NHS. And with over 870 GP practices across the country now specifically altering their services to accommodate veterans as part of the veteran-friendly accreditation programme, 59 veteran-aware accredited NHS trusts, the lived experience of veterans across communities in the UK is significantly changing at a pace we have not seen before. I, of course, pay tribute to all of the staff who work in these areas, who I champion at every opportunity. Those who work in delivering the programmes in communities across the nation, those who work so hard in the third sector, often volunteering at huge personal cost, simply because they, like me, believe we should do better by our veterans. And of course, I pay tribute to all of those in the Office for Veterans Affairs. But this launch today is a genuine game changer. Harnessing the Transition and Liaison services, the complex treatment service and the high-intensity services under Op Courage gives us an opportunity to bring a real, clear understanding of the NHS provision for mental health for our veterans and a genuine springboard to accelerate and drive forward all of the fantastic initiatives in this area. Op Courage will be the front door to a range of services for mental health issues. Anyone struggling can call or email, where they will get an assessment support with Defence Medical Services if they are transitioning and an early identification of mental health problems. After that, there will be therapeutic treatment for advanced mental health conditions and psychological trauma, intensive emergency care and treatment if you're in crisis, access to other NHS services, and of course support from charities and local organisations with wider wellbeing needs, for example housing, relationships, finances, employment, drug and alcohol misuse and social support. Informed by partners like the King's Centre for Mental Health Research and Forces in Mind Trust, and crucially driven and designed by service users and their families, there could be no credible reason why every GP practice across this country and every NHS trust cannot know and understand Op Courage, get themselves or their institutions veteran-aware accredited and genuinely be the pathways to access all of the brilliant support Op Courage will provide. Because doing right by our veterans is a national responsibility, a whole of government effort and indeed a whole of society effort. The Office for Veterans Affairs, working in tandem with the Department for Health and Social Care, will do all we can to design and deliver programmes that can tackle the significant challenge of looking after the mental health of our veterans. But it's on all of us to contribute in our own small way by understanding the pathways, asking our leaders why they're not part of these programmes, but crucially encouraging our veterans to seek help, because help is there. And that is what I want to be the clear message that goes away from this conference, one of hope. Help is available, people do care, The Prime Minister cares. I care deeply. Engage with these programs because you can get better. The Office for Veterans Affairs is engaged in a relentless pursuit of excellence when it comes to veterans provision in this country, and we will not tire in that endeavour. I accept we start from a low base. I accept veterans care was, like I said in 2015, a stain on this nation. But that is changing, slowly, surely and irreversibly. Engage with the programmes, seek help and speak up. Indeed, have courage.